Now we'll move to the economic impact on healthcare system. We have a distinguished speaker who's Dr. Hana Abdulkareem. She's a director of the Drug Policy and Economic Center in National Guard Health Affairs, Riyadh, Saudi Arabia. Prior to this, she worked as a pharmacoeconomist, specializing mainly in conducting pharmacoeconomic evaluation of oncology, hematology medications. She completed postgraduate diploma in business and law from University of Sheffield, UK, and she obtained her master's degree in health economics and decision modeling from the University of Sheffield in UK, in addition to training in health economics at the University of Manchester. In 2018, she completed the Health Economics and Outcomes Research Certificate Program at the University of Washington University in USA. Dr. Hana, main professional and research interest is health economics and outcomes research, optimal healthcare resource allocation, informing decision-making with regard to drug use, and finding cost control strategies. She has been invited speaker of local and international conferences, and she participated as co-author in many publications. Welcome, Dr. Hana Abdulkareem.
Thank you, Prof. Ahmed, for the nice introduction, and thanks to the organizing committee of the conference for inviting me. It's really a pleasure to be with all of you here today. And thanks to the other speakers who made my task very much easier today. So I'm going to talk about the economic impact of the pandemic on the healthcare system. So I have three key objectives. First, to explore the impact of COVID-19 pandemic on global economy, to discuss the impact of the pandemic on healthcare system in particular from an economic point of view, and then discuss the road to a new normal. So as you all know, on March 11 of this year, COVID-19 was declared a pandemic by WHO, and since then the world is in a state of emergency due to the rapid spread of the virus. And nowadays, as Professor or Dr. Fauzi mentioned, we have more than 61 million confirmed cases around the world, and almost nearly 1.5 million deaths. So no one expected this. No one was prepared to deal with this crisis. It was unpredictable. It came with high cost, larger scale of health challenge, and it required urgent mobilization of resources. It affected the whole population in every single country, and it took a long time to resolve, and it's still ongoing, honestly. So the pandemics in general, not only COVID-19, are not just a health issue in isolation, and COVID-19 in particular has emphasized that this on a global stage. There are huge, in addition to health impact, there are huge social, economic, mental, and even political consequences that are being felt across the world because of this virus. And we need to be looking at the virus in terms of all of these aspects. Considering the possible long-term consequences of the pandemic, is important to inform both short and long-term responses, and to be also prepared for the pandemic in the future. So, as I said, I will be focusing mainly on the economic impact, which is significant. Many countries now started to assess the economic losses and try to find ways to mitigate them. For the first time in the history, a health crisis has shut down the whole economy around the world, and painfully this demonstrated how healthcare and economy have become inseparable. And from a global economic standpoint, the World Bank projects that global growth is expected to shrink by at least 8%, with poorer countries feeling most of the impact, and also United nations expected that this pandemic may cost the global economy around $2 trillion this year. So as you can see, almost every country in the world has taken measures to prevent and contain the virus, which collaterally have affected the world economy. And the immediate consequence have been a sudden stop of global production, creating disruptions in supply chains and ultimately disruptions in financial market. So also people stay at home because they're either cautious or because their governments make them stay at home to reduce the spread of the virus, and which means that we have lower output in the economy as much of the work cannot be performed from home, but also you get also lower demand because people are staying at home, they're not buying as much and they're postponing investment decisions. Another badly hit area is tourism as well, due to a travel ban, which many of the developing countries are heavily dependent on. That's something that is expected to be affected for a long time by the pandemic. Another thing to mention here is that government increased the spending on healthcare, and this is will be discussed in details in the second section of this presentation. So in general, economic growth will be impacted by a reduction in activities in commerce, construction, transport, hotels, restaurants, and which means the total financial or fiscal revenue will be reduced. So in the Gulf region in particular, the most obvious effect was on oil production and prices. And as you know, oil prices are volatile, and with any change, not only in the economic environment, but any change in the region can impact their prices. Tourism also sector suffered also from the pandemic. Also, as the same as any other country, we've seen global value chains disruption and slowdown in all the economy. Looking at the Arab world overall, unfortunately, reports expect that at least 1.7 million jobs will be lost due to the pandemic, and it is expected that the GDP in Arab states is expected to decline by at least 42 billion US dollar in 2020. So I will just classify or break down the economic impact of COVID-19 on healthcare system into 5 categories. First of them is the direct financial impact due to treating and testing the COVID-19 cases, the long-term and unknown health impacts of the COVID-19 cases after recovery, and the cost of delayed treatment. Also the cost of physical and behavioral health issues that will result from sheltering and staying at home at lockdown periods. And lastly, the loss of revenue in private hospitals. So this analysis shows that the COVID-19 direct cost, which is expected to be roughly, they expect that 76% of the patients who seek a treatment, they get at least testing and basic services, which cost per patient around $250 US dollar. 17% of the patients are hospitalized with mild and moderate conditions, and the cost per patient is around 15,000 US dollar. The remaining 7% are treated for severe conditions. And for every million people that seek treatment, the US healthcare system incur around 5.3 billion in direct cost only. So to prepare for the surge in hospitalized patients, hospitals needed more negative pressure rooms, more ICU and isolation rooms, more testing facilities. They need to implement telehealth facility to hire more staff, to pay for overtime for staff, educate the staff, and to provide them with personal protective equipment. Reports about the total expected direct medical costs around the world. There are several studies that looked at this in the US, and the average is between 163.4 billion US dollar per year to up to 654 billion US dollar in the US. Another study in Sweden found that this may cause around 2 billion US dollar in Sweden. Looking at the mean direct medical cost per patient, in the US for non-hospitalized patient, one study estimated that the cost per patient will be around 3,000 US dollar. And if patients are hospitalized, they may cost the system up to 14,366 US dollar. The mean direct medical cost per patient has been reported to be around 2,395 in China, around 10,000 in Canada, and 633 in India. I couldn't find much of evidence for our region. However, I found one study that estimated that the costs, the medical cost per patient was estimated to be around 50,000 Saudi riyal, which is around 13,000 US dollar, which is not significantly different from the one reported for the management of MERS-CoV virus that was spread in our country. The hospitalization rates in Saudi Arabia is around 71.6%, mortality rate as low as 0.65%. The median length of stay was around 7.93 days. These parameters are very important to inform costing studies if you want to quantify the economic burden of any disease. So a recent local study tried to calculate the mean cost of hospitalization per day or per patient. The study showed that the cost of hospitalization that was estimated using micro-costing method, as stated in the protocols of COVID-19 management set by MOH, they found the mean hospitalization cost per patient per day for those who are admitted in general medical ward to be around 5,192 Saudi riyal. However, of those patients required ventilators, the cost increased to around 7,308 riyals. If those patients were in the ICU but did not require the use of ventilators, the cost is 7,810 Saudi riyal, increasing to 11,215 Saudi riyal per patient per day if the patient is in ICU and requires ventilation. Also, this study attempts to quantify the total cost per direct medical cost per patient per day based on length of stay data, and it's estimated that the mean hospitalization cost for patients admitted to the ICU and not on ventilators was lower, interestingly lower than that of patients on ventilators. As you can see here, the patients on ICU, the average was around 73,000 Saudi riyal. If they require ventilators, increased to 84,000 Saudi riyal. And in general medical wards, if they do not require ventilators, the total cost is around 42,700 Saudi riyal compared to 42,558 Saudi riyal. Other impact is the long-term impact or unknown health impacts of those patients who recovered COVID-19, which is currently is unknown, but is expected to extend far beyond the acute impacts. We don't know if those patients have other issues that will appear in the future. For example, I was one of those who got infected with COVID-19. It was not that bad. However, even after 5 months now, I still I cannot smell or taste food. And treating such conditions might even be costly to the system. Another impact is the exacerbation of delayed treatment, and this was mentioned by several other speakers, including Dr. Abdulrahman Jazia. Many patients who have chronic and acute conditions delayed their treatment either on purpose because they're afraid of coming to the hospitals, or because of the lockdown, their treatments were canceled. And the resulting cost to the health system can be substantial. It's largely driven by the expected increase in the severity of the patient symptoms due to care referral. This graph from a recent report shows that if you look at the impact of delayed treatment across different conditions, you can see that the impact can be substantial. For example, the average cost of treating a patient with COPD has potential to increase by between 7 and 11%, going from approximately 3,800 per patient per year to approximately more than 40,000 per patient per year. Looking at cancer care, for example, which costs the US system around $200 billion US, is expected to increase by 8% to $214 billion US per year. The fourth impact is the long-term effect of COVID-19 on physical and behavioral health impacts resulting from lockdown. For example, the impact of bad lifestyle habits that can result in for example, limitation in exercise and movement, which can lead to obesity, hyperlipidemia, prediabetes, and many other lifestyle diseases. Also, there is the behavioral health toll of anxiety and depression resulting from the virus itself, the extended lockdown, and the subsequent economic downturn. One study reported that there was more than 20% increase in prescription for drugs that treat depression, anxiety, and insomnia. So as you can see, this has potential to further impact the system for years to come. This graph shows that people with behavioral health diagnosis have around 4 times the average healthcare spending of those without, mainly due to factors such as medical complications, reduced access to preventive care, and other challenges with illness management. Although this analysis is a correlation and does not imply causation, individuals with behavioral health conditions consistently have higher spending for physical health care compared to individuals without behavioral health issues. There is also, as you can see here, this graph shows the expected increase in potential spending on healthcare for people with behavioral conditions due to COVID-19. As you can see, it is expected to have, if we say on the low risk scenario, 20%, and high risk scenario, the impact may reach up to 30%. The impact on the private sector, which is clear, there is lockdown, elective treatments are cancelled, including surgeries, appointments, and all other healthcare services. People are visiting private hospitals less often. There are also staffing issues, so which translated into direct loss of revenue. So now what? After COVID-19 and this pandemic would challenge the priorities of healthcare system, would challenge our ability to adapt, change the way we approach healthcare and think about it. Now it's time to think about the new normal. As you know, outbreaks are like black holes. They draw in all resources, all expertise. This disease created an economic crisis, a long health crisis, of course, and it's obvious that we're going backward on an agenda like, for example, maternal survival, child survival, dealing with different communicable and non-communicable diseases, including primary healthcare issues such as, for example, very simple issues such as delayed vaccinations. So despite the desire to return to normal life, COVID-19 will clearly continue to shape a next normal for the whole world. So we need to work together to better adapt and develop or restore our post-COVID-19 system. We need also to use this pandemic as a leverage to a better healthcare system in the future, learning from this experience. So one of the obvious opportunities is the long-term shift to telemedicine, which can result in substantial budget efficiency. We need to keep virtual care, home care when appropriate, and we need to have a proper funding for these activities. Access doesn't always mean that patients should be here physically, and the virtual way can also save money and time. Also, healthcare stakeholders should start to prioritize addressing urgent cases related to delayed care, such as delayed treatment to those with, for example, cardiac or oncology conditions. We need a strong framework for addressing behavioral health concerns, to manage the demand on the system post-COVID-19. We need to acknowledge that the full healthcare impact of COVID-19 may not be known in the future for years to come. We need also to, as was mentioned previously, we need to try to increase the hospital budgets at least 1%, as mentioned by Dr. Bertham. We need also we need better interaction with and partnership with payers, suppliers, primary care, and all parties to discuss ways to improve value generation and sustainability after COVID-19. With this, I end my presentation. Thank you very much.